Hey everyone, can't upload consistently to save his life here. I'm back again for part 3 of the side effects video for the Cancer Chronicles. If you haven't seen the other 2 parts of this, I'd really recommend watching those before you come over to this one. By the end of this one, I'll have covered off pretty much every side effect that I suffered with throughout my treatment, but if there's anything else that isn't covered and you need some help finding out some more information about, feel free to message me. I've been feeling pretty ill quite consistently the last few days. My energy levels have just been all over the place, and I've just been feeling really run down and quite groggy. I think that's because I'm in the middle of having my revaccinations done, which, a bit like I explained in the video I made about my experiences with the COVID-19 vaccine, which were mostly positive, and that's not to deter you from it at all. That was just pretty honest reflection of how much I'm benefiting from it, but at the same time how ill I felt in the process. I was warned that I might feel pretty ill for a few days after having these, and I've only had half of them done. I go back the day before my birthday, funnily enough, to have the other ones done. So, yeah, I'm looking forward to that. Not really. So, yeah, in this video, the plan is I'm going to talk about... so we've covered off, so far, I'll just quickly list off everything we've discussed. We've discussed nausea, hair loss, fatigue, peripheral neuropathy, muscle degradation, or muscle atrophying. I don't know why I said that because I wasn't sure. Muscle atrophy. Mucositis and mouth ulceration and cognitive impairment, as well as binge eating and loss of taste. So this one will probably be a little bit shorter, but we're going to be talking today about blood transfusions and difficulties with going to the toilet. I've had conversations recently about particularly the going to the toilet part, so I think it's probably worth giving those to the highlight in this episode. So yeah, that's probably useful because I won't feel the need to sort of push off into going to talk about something else. So we'll probably start off just by talking about blood transfusions because they're less of a side effect. They're sort of an outlier here, in the sense that they're not a direct. They're not a direct side effect from chemotherapy, but they're something that you will likely have as a result of it. So I guess the more appropriate subtitle for this section of the video would be anemia. So many patients become anemic throughout their treatment. This is because, as I've explained before, it's the same reason I need to have my revaccinations done. It's the same reason that you'll lose your hair. It's the same reason your muscles will atrophy. It's because despite the good that chemotherapy does in targeting malignant cells and killing them off to treat your cancer, they're quite indiscriminate and they'll affect a lot of the other tissues and cells throughout your body. So the damage to these cells is pretty much the explanation you can give for the majority of side effects that people experience. So with your red blood cells, they're what's responsible for carrying oxygen around the body so that you're able to carry out the process of respiration. So with fewer of those, you're not as able to carry oxygen throughout your body as effectively, and that creates problems with you become short of breath, your stamina gets a bit lower, you get lethargic. I've had it really bad at times. It particularly tended to coincide around the times I was dealing with mucositis. So when I was having those issues in particular and I was sort of bedridden, so in my old family home, so my bedroom was on the first floor and the only toilet in the house was on the ground floor. And when my anemia was particularly bad, I would find that I could barely make that journey there and back. It was really bad. As soon as I got back into bed, there was no way of even sitting me up for a decent period of time afterwards because I was so exhausted because I had fewer of those blood cells, getting the oxygen around the body so that I could actually move. So it's not particularly fun. I'm pretty sure it was the chemo after that where I very much struggled to make the journey from the car when we arrived to get to the Macmillan Centre. When I did, I was sort of leaning on a guide rail sort of on the side of the wall, which are sort of all throughout the third floor of the Macmillan Centre. And it's in hindsight I realised that this is probably because people do struggle with their energy levels, and sometimes not really supposing about it, I had that exact problem of lacking the energy and the well-being to simply manoeuvre around the ward sometimes. So I was practically leaning on that, and I was, sort of falling all over the place trying to have a conversation with them, like doing my normal check-ins so that I could come in to do chemo. So they could tell that I was, moments from collapsing, so they made me get in one of the chairs, and I basically collapsed into it. I can't remember exactly, but I'm pretty sure I fell asleep or sort of semi-passed out for a while. That was really not fun. That was, I'm pretty sure that was, because I said before that this sort of coincided with the mucositis. In the end, it ended up being quite a funny day. They prescribed morphine to try and reduce the pain in my throat so that I could actually eat, because even though I'd managed to eat small amounts since my trip to the hospital that I discussed in my last video, I was still very, very hungry and thirsty at this point. I was not eating or drinking an acceptable amount at that point. So they gave me morphine, and I was able to sort of choke down some chicken nuggets from the nearby McDonald's, and then I passed out. And when I say passed out, I was sort of in this really weird, I don't know, it was like this weird plane of existence between being awake and being unconscious, where I was just hallucinating in my chemo chair. So, there are worse experiences, I suppose. I remember one of the other patients who I did chemo with for quite a while, Fatima, her and my dad laughing between each other, because I was I didn't realise at the time I was sort of intermittently talking about what I was hallucinating about without realising. I think the highlight of it was there was some weird, I can't even describe it. I ended up being on this weird roller coaster that I didn't realise how high up I was, and then it sort of crested at the peak, and then as I went over I realised that I was actually in a space roller coaster and I was plummeting straight towards the earth. And then there was some weirdness with me getting chased around by anthropomorphic books with arms and legs that were trying to eat me. So not a particularly enjoyable high. I couldn't imagine doing opiates recreationally. I hated doing them when I had to do them. It is not fun hallucinating while you're on opiates. I mean, it could probably be amusing for the people around you, as I've experienced, but in the moment, I don't know. I remember being kind of spaced out, but in hindsight, they're probably quite traumatizing, those hallucinations. So I'm babbling again, sorry. So because I was anemic, it's dangerous to continue doing chemotherapy if your blood count is under a certain level. I can't remember exactly what count they used for it. It might have been oxygen saturation that they used to validate whether I was healthy enough to do chemo. And on this occasion and a couple of others, I had to have transfusions to make sure that I was okay to do chemo. I think in the end we ended up negotiating we sort of set up a procedure where I would have blood transfusions preemptively to stop my blood count from dropping low to the point where it could interfere with chemo anyway. So that was a better position to be in. But the story of my very first transfusion was quite an eventful one. They're not a particularly dangerous procedure. Blood is checked to make sure that it's clean before you have it. There's a very, very low chance of it causing you problems. But, for some reason, so the nurses always described it as it's like a big boost. So you would have a transfusion, and you'd have these extra red blood cells, and you'd have sort of almost this, you'd sort of have this injection of basic normal human, health or functionality just sort of inserted into you directly. And they always describe stories of how other patients who'd had them within a few minutes would perk up, and it was quite sweet. In my journal, I think I described it like this in my journal, or a way I've always thought about it is it's like a window to your former self. in the sense that you get more of that energy back and you physically feel more like you did before you started treatment. That's not how I experienced it though. I definitely felt it with later transfusions, but when I had my first one, I got more pale, I got more disoriented, and I got more tired, which is really pretty much the opposite of what you would expect from someone having a transfusion, which freaked my nurses out and my parents out quite a bit. I mean, because I wasn't really with it, I started getting quite disoriented. I thought I was fine, you know, I was in quite a jolly mood at the time. But they had to not cancel it. They stopped the transfusion briefly, and then when I sort of returned back to normal, they carried on, and there weren't any other problems. It was a weird scare, but it's, you know, in no way is a criticism of blood transfusions themselves. I think they're great. You know, it was almost like being like a vampire. Like I would almost look forward to transfusions before I had them, because I would know that it is sort of like that temporary restoration to your former self before you get bombarded with even more chemotherapy. Yeah, so they're pretty good. I don't mind them. If you're doing treatment and you hear you need to have one, it's not something I'd freak out about or feel nervous about, because it is a good boost, and it's quite a novel sensation when you're having it and thinking about, you know, that's somebody else's blood, you know, that's somebody else's generosity that's enabling you to feel that good. And I don't know, it's so strange, like the feeling. Yeah, so that pretty much covers off sort of my thoughts on anemia and sort of the associated treatments for that. So I guess the last thing that we'll talk about, and it's quite fitting seeing as it's at the rear end of this video series, and you know, quite aptly that's the area that we're talking about. Something that a lot of people have trouble with when they're doing chemotherapy, and something that I think is particularly associated with more aggressive chemotherapies like doxorubicin. They can create sort of quite bad problems with going to the toilet. So I would I'll just sort of try and set the scene for it. So a few cycles into having doxorubicin, I would find that I would become quite sore after going to the toilet sometimes, and it was bearable at first, but it quite quickly became like progressively intolerable, to the point where I couldn't go. Like the pain was so intense that I, you know, developed like a temporary aversion to going to the toilet, and all the willpower I could summon couldn't prompt me to go, because, you know, in the same explanation for mucositis and other things like that, when chemotherapy travels to certain tissues, it breaks them down, and it makes it easier for you to damage them by certain activities. So like tissue in the throat, when you're doing chemo, it's easier for your throat to get sore when you eat, which is a problem when you binge eat. So in that same sense, and because the tissues of the throat and sort of the areas associated with going to the toilet, chemo tends to flow there quite easily anyway. I don't know if that's because there's a lot of blood vessels or otherwise there's quite a lot of blood flow there, but chemo gets there and it breaks those tissues down, and it can create quite severe problems with it. I think it is one of the most difficult side effects that I had to deal with at the time. And it's probably the one that affects me the most still to this day. You know, the issues that I developed with it at the time are, you know, I guess they are what you would describe as chronic, in the sense that I still suffer with them now, and there are still considerations that I have to make with it, and, you know, steps that I have to take to make sure that it's not too difficult. I'd say it's sort of periodic in the same way it was with chemotherapy. Like, it goes through a cycle of healing and not being so bad, and then it sort of repeats where it becomes progressively more sore and worse, and then it hits a peak, which thankfully since stopping chemo, that peak isn't anywhere near as high. So yeah, so at the time I couldn't go to the toilet. I spoke to somebody on the phone who set up a doctor's appointment for me so that I could go and see someone, but it was at like 4 in the morning in the hospital, and by the time I got there, in fact, maybe to be fair, maybe slightly early, maybe like 2 or 3. It was very late. By the time I got there, it was so delayed that me and my dad just went home because we were so exhausted. I just wanted to go home at that point. So he took me home, and I remember just laying in bed thinking, what can I do? I haven't been to the toilet in days. I'm in so much pain. I don't know what I'm going to do. I don't know what I'm going to, how I'm going to cope with it. Very, very fortunately for me, I had sort of a day clinic to go and have my PICC line redressed at my local hospital, and it sort of has like a small area of the hospital there for people who are having sort of long-term care and have regular procedures carried out, like having their PICC line redressed. So I went there, and just like with the Macmillan Centre, all the nurses just absolutely lovely people. It's the same now. On some level, I do miss them. I always do. And I was very lucky to have one Dr. McGuinness there, who is absolutely lovely. Just puts you at ease instantly. And I spoke to her about the problem. I felt quite embarrassed talking about it at the time. I think over the last couple of years, I'm phrasing it in a delicate way now, just sort of for the sake of the video, but over the last couple of years, I don't really have that many reservations about talking about that area, obviously when it's appropriate, but it's quite a personal thing. But in that moment, I had to sort of let go of any pride and just say, listen, I can't go to the toilet because I'm in that much pain, because I just have all these tears and cuts because of my chemo. And the resolution, and the one that I would advise people to go and seek, was I started from then on, and throughout all of chemotherapy, I would have this powder called Laxido, which is essentially a type of laxative that breaks down everything that comes out when you go to the toilet and makes it far softer. So means that while there were still times where it was quite painful, it's just a lot easier to go to the toilet in general. Far less painful, gave tissues a bit of a chance to heal periodically. And I would take that twice a day throughout pretty much the remainder of my treatment when I could. And it tasted vile. It was meant to be orange flavoured, but it was just all bitterness. It tasted like bile. So I'd have to pour this sachet into a glass and mix it up, and I would just down it and sort of pretend that it, just pretend that it was something else. So that was really difficult, having to do that twice a day, just for the luxury of not being in an extreme level of pain going to the toilet. And as I say, it's a problem that has followed me out of chemotherapy, which is something I didn't really anticipate. I mean, it's not a problem I anticipated having in the first place, but it really sucks. It's not fun. So if you do have that, I mean, the most, the things that I could, that I would advise are the first, I tried to deal with it for too long. Talk to your doctor, or talk to like a medical professional that you have access to or in communication with frequently because of your treatment, and just tell them about it, because, and that's something that I repeat throughout all of these videos, just tell someone, and the chances are there is some sort of remedy. There are creams you can apply to the site itself to help healing. There are, these powders and other laxatives that you can take to make going to the toilet sort of less of a endeavour in the first place, and just on the whole make it like it wasn't fixed for me. I couldn't have the problem fixed, but that communication put me in a position where it was nowhere near as bad, and I'm just so lucky that that infrastructure and those people are there to make that, to try and ease that burden, because I was at my wit's end. I didn't know what I was going to do. I was sort of in my mind going, okay, I'll figure this out when I get back, because I hadn't considered approaching my because it wasn't at my treatment centre. The plan was, I'll just try and figure out how I'm going to make myself go today, and I was trying to psych myself up for that torture, and then deal with it when I got to my treatment centre. But luckily, because I went to have my PICC line changed, by chance I had that problem resolved. But considering that situation, there's easily been circumstances where people haven't had that resolved, and I dread to think like how intense and horrible that is. So I am sorry for that. I'm really sorry, because that's, yeah, I wouldn't wish that on anyone. But that's, that's the core of it. And I think if you're noticing a pattern, that's because there is one, in the sense that when you have issues, just keep communicating with your doctor or your nurses or whichever professional you talk to. Document your problems that you're having while you're away not having chemo, and then as soon as you get the opportunity, talk about them, and then you can try stuff out to try and fix it and just make the whole thing a whole lot less unpleasant. So I think that wraps it up. I didn't quite realise, I guess when I look back at it, the level of hell I went through enough to turn this series. I mean, it's sort of largely because I waffle on when I'm talking about it, but there was a lot to talk about, and I was remembering things as I was going through. So I think that's sort of like my collective knowledge when it comes to the side effects. But as I said before, if there's something that you're still not clear on, or you want to have a conversation about, Gamma Stories, Instagram, I'll talk to anyone on there. So I feel free to get in touch about it. I hope this video was useful. Again, apologies for ending the stream slightly premature yesterday. Like I said at the start of this video, I've not been too well recently, so I'm hoping I'll be more on form for next week, but I'll forewarn that the week after I'll probably have some of those problems again. I've been warned that it might be slightly worse next time because of the combination of vaccines I'm having. So I guess just watch the space. I'll make sure that something is at least coming out on the dates that I promised. There'll be a Chronicle no matter what. So that's the plan. And yeah, I look forward to seeing you there. I hope you have a lovely rest of your weekend. Aware this is coming out slightly late, so I hope your Monday is bearable. And yeah, I'll see you whenever I'm here next. So yeah, take care everyone.